everyone. Of course, I'm Leslie. I welcome you and thank you, and those of you that may come on to YouTube and hear this afterwards, I welcome all of you. The goal of Electric Impulse is about helping people protect their value. So it dawned on me that women especially, and this was open to men, because most men either spawned a female or live with a female or have a female mother, but the whole reason for doing it is that during this shelter, safer at home time, it dawned on me that women have some challenges that men don't necessarily have, and I wanted to address that. I think that COVID-19 has all of us. I think my dogs are affected by COVID-19. I think it's affected women differently than men. What we are doing, what can we do to protect ourselves as mothers, as parents, as grandchildren, as children, as sisters, as daughters, inspired this Zoom session. There are many voices out there. I choose to listen to professionals, so I invited a professional today. Dr. Deb Plate is a family physician at Cleveland Clinic, Akron General. Her idea of a vacation is taking medical supplies and her medical peers and going to third world countries and helping there for a week or two. That's her idea of a vacation. So she, the same expertise she takes to third world countries, she's going to bring us today. She has also become an expert in telemedicine, as she's now been doing appointments, virtually instead of in person. You can hear her and ask her questions each morning, Tuesday morning, 7:15 on the Ray Horner Show on WAKR, and also today. So Deb Plate, Dr. Deb Plate, I welcome you and I thank you.
Thank you. Nice to be here. Thank you.
Yes, you will be able. You can send me questions. You can unmute yourself and you can ask a question. I'm going to start out in this way. I heard a great comparison that if you drop a teacup, it breaks. If you drop a rubber ball, it bounces. So I suppose our goal is to be resilient enough to bounce and not break. I think he thinks I'm fearful. I think he's in denial. This prompted me to believe that women and men look at this virus differently. Do they, Dr. Plate? Have you found
that's interesting.
Women and men look at it differently?
Yeah, it's interesting. I really see the full gamut. I have several male patients that are extremely sensitive, that seem to really take this on very, very seriously. But I think the majority, when you look at the numbers in Europe, for COVID, 63% of the death rate were men. And here in New York City, twice the amount of men to females for deaths. And so one would think, gee, is there something going on, male versus female, or is that even related to their role or personalities, what have you? We certainly, in our world, actually, Cleveland Clinic Akron General has had the highest number in the entire consortium for COVID-19 patients in the hospital. Now, high, not like New York City high, but for us, 44 patients in the hospital was an all-time high for us a few weeks ago. And it certainly has not been something up to this point that we had anticipated, as we were all ready to really take on other responsibilities. So we know that as females, our immune systems are different than men. And so there may well be something to the estrogen world versus the testosterone world. So there are some differences when it comes to that. But we're also tend to be a little bit more cerebral and sensitive to a number of things as caregivers ourselves, whether it be for parents, children, what have you. We carry a lot with us in addition to whatever else we might be doing day to day. And so that certainly can take a toll. Men are likely to engage in higher risk behavior than we are, for the most part, ignoring physical distancing. I've seen it. Taking on a role such as blood pressure, liver disease, smokers, heart disease. They may be more vulnerable in many cases. And so that also can play a role. So a lot of reasons play a role, but there is some thought out there through the research that we may have a jump on things as far as the immune system.
Well, let me ask you, In a world full of talking heads about, especially about COVID, you're a physician, you come from the field of science. Who do you believe? Who do we believe?
And I think somebody needs to mute because there's a lot of background noise. Can everybody hear okay? There we go. Okay, great. Thanks, Lizzie. Yeah, so, who do we believe? And it's interesting. We're very fortunate. Never have we felt so fortunate to be affiliated with the Cleveland Clinic, a national and world-renowned enterprise. We feel very fortunate at this point, as they have really brought in a number of experts to give us updates on a daily basis. And so, we have a lot of information coming through the Cleveland Clinic Foundation with regards to that. Most of us as clinicians will hold tight to the cdc.gov. There's a coronavirus.gov that is also felt to be very reliable. So cdc.gov and coronavirus.gov are both reliable sources. As I looked at a few and prepped for this, Leslie, and went through some of the Googling that goes on out there, guys, there's a lot of misinformation out there that you have to be so careful with. And so sometimes we forget unless we really delve into that to find it. And I was surprised how much was out there that really was not as accurate as I would like. So when you Google and look at something, look to see where that comes from. Is that WebMD? Is that CDC? Is that the Ohio Health Department? Be thinking about where your resources are as you look at some of these things online.
Economically, this unemployment rate, different than, say, the 2008 recession, this unemployment rate has affected women more than men because of the professions that have been affected in healthcare and education and hospitality. Are there some things for women to keep in mind that will help protect themselves psychologically, emotionally, should they be furloughed?
And so, the question talks about how we have been so impacted by this as females with regards to the unemployment rate. And it's a huge issue. And so much of what I've seen, I was on the phone or on the computer all morning this morning with patients, both men and women. And of course, the topic is all about this. So many of them are hurting. I had a patient last week, and truly I can't say a patient, but I take care of her husband and I've known them for years, and she's elected not to have a medical home, who took her life last week because of financial concerns, husband's health. Their business was really struggling because it was their own business, and not many folks out there right now are looking to photographers for family portraits. And so they were really, really struggling with this. So, we're deeply saddened with that. And so I do think as females, we tend to be very good at looking at the whole picture with high sensitivity, in addition to a business mind and model as well. And that takes its toll. We were talking a little bit, Leslie, before we got online about cortisol levels. And cortisol levels, guys, determine your blood pressure, your blood sugar, weight, sleep, a number of things. And so what's really critical, and I think so many of us are really pretty good at this and maybe sometimes need to be reminded by somebody close to us, is it's important. I talked to actually a male this morning who said, Debbie, every time I worked for an hour from home and then I go out and walk, and then I come back and I work and then I go out and walk. What a great concept. His weight's down about 8 pounds. It's great. And so, he understands how important it is to try to wipe that slate clean for a moment, take a breather, and what that does to you internally is huge. I look at folks in the whole picture. In family medicine, we don't just look at the gallbladder. We don't just look at the...
It just froze. Okay. Just our guest, Dr. Deb Plate, just froze. It'll come back. There she is.
Okay.
Yes.
So I was just saying, in family medicine, we really look at the whole picture and how important it is. Every patient I see, I ask about mood and stress, because I recognize that blood pressure, sugar, pain level, weight, sleep, everything is dependent upon that. And some of us need help with that. Some of us need help with how to cope with that. And so giving out strategies on how to do that, I think, is really important. And knowing, like my dear friend last week, who, was really made a choice knowing that it can get, that desperate to make a poor decision.
If there was, and I know that there's as many strategies as you have clients, but if there was one that perhaps is more popular, or the first strategy you would go to if someone said that, they were struggling, what would that be?
Well, I think connection. Every patient I talk to, we talk about connection because people are so isolated right now. I had a dear patient of mine in Rocky Knoll that I talked to this morning, who's delightful. And we were talking about how she's connected and they have fun things they do on Zoom. They used to meet at Brugger's every morning. Well, Brugger's right now, you can't go in and sit. So they have a Brugger's group that gets on twice a week and they talk on Zoom at the age of 86, which I love. And so finding ways to connect, I think, is really important. And sadly, I think that this particular friend was somewhat isolated because of some of that. And so reaching out, having awareness that all of us are struggling in some way with this. This is not an isolated thing, one person versus the other. Everybody is impacted by this in some way. And, I'll remind you, our number one killer as females is heart disease. Not breast cancer, not ovarian cancer, but heart disease. All of those being very important. We've done a great way of getting the message out about women and cervical, ovarian, and breast. We've not done such a great job with regards to heart disease. And heart disease is elevated cortisol levels, worried about him, her, the kids, mom and dad, and dealing with, what happens if I go out to the post office? What do I do with the package on my front step? Do I allow it in? Do I let it sit there for 24 hours?
Okay, since you brought that up, what do we do with our groceries and the package that Amazon brings us? What do we do with that?
Yeah, good question. And again, I had many this morning. Every phone call that I spoke with patients were asking those questions. And so these are important questions. What have we heard? We've heard initially when it first came out that we thought it might be able to live on a surface for 24 hours. And then what did we hear? Then we heard that it might be even a little bit longer. And so, and a lot of patients out there and folks out there are actually leaving things outside or lining them up in the garage or sanitizing everything that comes in, every package that comes in from the grocery store. And I'm not sure anybody really has a good answer to that other than to say, use good judgment. We know at least 24 hours to where I think we need to be careful. Anything that comes to my step, I leave the box out there, I open it out there and bring in the contents and leave the box outside, doesn't come in the house. So that's my way of being able to deal with that. I think gloves are important. If something is coming to you that is not in your home, whether it be mail, boxes, groceries, things like that, probably not unreasonable to, use gloves, come in and then wash. Washing 20 minutes is something that Ray Horner and I are talking about every week.
20 seconds. 20 seconds.
20 seconds. We usually say either the happy birthday song or the alphabet, just to make sure that you're getting a sense of doing that correctly. And it reminds you, and I would guess most of us haven't watched this much in a long time. And so I think that's important. And reminding some of our folks who aren't always used to that, to doing so.
So, I am still walking my dogs every day, respecting social distance, okay? But I have run into a couple people as I'm walking, at least 6 feet away, but they have grown kids, adult children who chose to come back and shelter at home. And they seem to be thrilled. But aside from them, for a lot of women, the kids at home means, more cleaning, more meals, more shopping, more washing, more helping with schoolwork, depending on how old the kids are. Again, we talked about connection, but is there something that women can do, or even the father, if he happens to be involved in this and maybe a primary caregiver, because they have additional roles, what can they do for their mental health?
Yeah, it's a good question, and it's so important to acknowledge. I have nurses, guys that are working all morning and afternoon on the phones constantly, and then at lunch, when they might get a break and they usually go walking, they're sitting there doing homework with their young kids at home. So no break there. And so there they are juggling both what they're doing as a caregiver here in the office as well as at home. So it's very real. It's very real. We talked about connections. We talked about reaching out. I had a patient online this morning, a grandmother who is teaching her son's kids math. She's helping with the math homework. That is her job. So Grandma's doing that. Luckily, Grandma has a great background in math. She taught math. And so if you can take advantage of some of those folks that have a strength in that area, I would encourage folks to ask for help. And Grandma is thrilled to see the grandkids, 6th, 7th, and 9th grade. And there she is helping them out with all their math homework. And so really making sure a partnership, if you have the ability to have somebody else share that load, very important. We at work said that we don't care what it takes. If your little one is calling you for homework and it's 10 o'clock and you're in the midst of 3 patient phone calls, get the phone calls done and make sure that you're attending to your little one as well, who needs help with homework. And so I think the workplace helping out to share that load a little bit. Normally we don't allow that, but obviously right now we are trying to make sure that the quality of life is as good as it is. And we're trying to take care of our caregivers. Remember, all of us are caregivers. And if we don't take care of ourselves, there's no way we're going to be able to handle what's in front of us.
So let's look at the ultimate caregiver, the pregnant mother. Okay, yay, she's pregnant during COVID. Woohoo! What should a pregnant mom look out for differently at this time than she would normally?
Well, that's a question that speaks close to my heart. I have a daughter who is 22 weeks pregnant. And so certainly we've been concerned. Luckily, she's a teacher and she's home until she delivers and will return next fall. And so for that, I'm grateful right now. But, I really encourage her to stay close to home. They do walk the dog every day. And so I do think being outside for everybody, if you're in the park system, if you are in the neighborhood, keeping your distance is very important. Do we need to wear a mask? You need to wear a mask if you're outside and in a crowded area, all right, which really you shouldn't be, but if you are, then it's reasonable to do so. If you're in an area that is spaced out and there aren't many folks, take in the fresh air. It's an important thing for all of us to do as it really resets how we think and feel. And so that being very important. So I think avoidance, Leslie, is important. I'm a big fan of gloves. I don't care how well we wash. I think if you are out and about for any reason, the gloves should be on. If you can get them, they're not easy to get, but most places have them.
We have gloves, Deb, then how often should we clean them or take them off?
Well, most of them that I'm thinking of.
They can become more of a problem than if we have them.
Yeah. Absolutely. I'm thinking disposable. So unfortunately, thinking each time we use them, then we toss them, which
what
is.
What about our mask? Let's say that you're wearing a cloth mask. How long do you wear it before you clean it?
1 day. They should be cleaned every single day. Okay, every single day. If you're wearing a cloth mask, whether it be soaked in hot water, whether it be in the washer, they should be washed every single day. Remember, that mask is not only protecting you, which is very important, but you're protecting others as well, which is important.
Is it true from a medical standpoint, my mask protects you, your mask protects me?
Yes, absolutely. So your mask protects you and your mask protects others both. Okay, absolutely. Absolutely.
So when we say wear a mask in public, what does public mean? If I'm going for my mail, where do we make that line of when do we wear the mask?
If you're going for your mail and you live in an apartment complex or you have to go into a lobby, then you should have a mask on. If you have to walk down a driveway, I think you're very safe to not be wearing a mask outside. But if you're around a lot of folks and you're outside, you need to be social distancing, physically distancing, and making sure that you are protecting yourself.
Now, one thing that I've heard is that, if you have a good immune system, then you're safe. Okay. Well, first of all, I don't know if any of us know if we have a good immune system. I actually had a client, I've really tried to reach out to as many people as I could, that told me that you just have to drink orange juice. And I'm thinking, if that's the answer, then I think we'd all be guzzling, orange juice. But are there things we can do to make ourselves healthier? And is there any particular food that we should eat? Someone asked me to ask you that.
Absolutely. Vitamin C is great, guys. A lot of us take vitamin C on a daily basis, or we have diets that are rich in color. Your job is to make sure that that diet is rich in color. I have a lot of patients who always laugh and say, Dr. Plate, I looked at my plate and thought of you because I had a lot of color. Reds, greens, yellows, things like that are all very important. And so keep that in mind. That's what's going to build your immune system. We can actually get too much vitamin C, so you want to be careful with that. Stick with your fruits and veggies, and certainly if you're comfortable with vitamin C, that's not unreasonable. You know, other things that can build up our system beyond nutrition is sleep and getting out and making sure that you are taking in some nice deep breaths. We talk about mindfulness. When you take that deep breath, you reset everything that goes on in your system, including your blood pressure, including your heart rate. One of the easiest things we can do in the midst of a stressful, busy day.
So let me ask you, if let's just say for a moment that all the testing in the world was available, who needs to be tested? Should you be tested if you have absolutely no symptoms and you just want that peace of mind? If you are tested, does it only mean that day that you're negative? And can we even trust that we're negative?
Yeah, good point. I'll remind all of you that the virologist that was on the Today Show who ended up on a non-rebreather, almost intubated, was negative 4 times. 4 times negative with what looks very much like coronavirus. So that really builds a lot of mistrust in our testing system. Do we have the ability to accurately test? And I will tell you that I'm not sure we're on it all the time, meaning we are very concerned about false negatives and very concerned about false positives we're going to act on, but false negatives is a huge concern. A lot of folks have called me and said, I just want to get tested. Well, and then we run them through our rubric and say, do you have symptoms at this point? Do you have the loss of taste or smell? Do you have a fever? Do you have a cough? Are you short of breath? You've all heard that there's been many different renditions of that out there, and nothing is really fitting the pattern that we expect. And many of us think we may have had it even in December and January, quite frankly. I can't tell you how many phone calls I have with patients that say, I had it.
Deb, that brings up a point. If someone does think that they had it,
yes,
and let's say that they were right, okay, does that make them immune forever if they had it?
That's a great question. We don't know that. We don't know that yet. And there's a lot of talk about can you get it again? And I think they're thinking that, yes, that may well be the case. If you've been immunized with antibodies, then that certainly may make a difference. But again, we don't have that yet to where that is a concern. So we do not know that yet.
So let me ask you, if you had to choose between Purell and hand washing with soap, is it equal, or is one better than the other?
Hand washing with soap is absolutely supreme. 20 seconds with hand washing is supreme. I'm not going to tell you I don't use Purell because I use it all day, but hand washing is my first and foremost, as it is with any infectious disease physician out there, if you do it correctly. And again, that's a time thing.
And how many times a day in our, we're not in the hospital like you are, but would you say for an average person, or the days that you don't go into the hospital, like, can you give us a criteria like 10, like see if you can wash your hands 10 times a day? Is there a number you can give us?
I'm not sure I can actually give you a number. I think anytime you change your behavior, or change your location, obviously it makes sense if you go out and come back in. If you have the UPS guy or the FedEx guy stop and hand you something, that makes sense. So anytime there's something that is coming in that's foreign, it makes sense. Within the home, I would say it should be something you should be thinking about every couple hours at least. Remember, even the TV remote, if anyone else is living with you, computer, TV remote, phones of any kind, you got to be thinking about it.
So let me ask you, I'm really worried about airplane travel, and even travel by car. At some point, you got to use a restroom. But if someone was traveling with an older person, a mom, a grandma, they're moving them, what are some things to keep in mind?
My math teacher this morning that I interviewed, my grandmother that interviewed this morning, who's teaching math to her grandson, said, by the way, Dr. Plate, we have a condo in North Carolina in July that we'd like to go to. And so we talked about safety of that. And we talked about, if you're traveling with someone, she has to go down. When they go down, they have to stop overnight. When they come back, they have to stop overnight. So we talked about how that would look. And gloves, mask, into the lobby, up to your room. Once you're in your room, sanitizing, I don't care what they've done, you still need to consider it. And it's not at its risk. She's 81 years young, and the entire family is going. They each have their own unit with their own separate entrance into that. However, the hotel on the way down, hotel on the way back, you got to be careful. And stopping at a restroom. What do we do when we have to stop at, a gas station to fill up, or at McDonald's, or wherever we'll be allowed in to use the bathroom? So we talked about how to be safe in doing so. Gloves, mask, I think are very reasonable if you're going to travel and stop in something foreign like that.
And in the remaining minutes, the last substantial question I have, and I have some faster ones, but if we do go back to school, if schools do go back in the fall, from the student standpoint and the families they come home to, anything that you can tell us to start thinking about now?
You know, I think we'll get very good at making sure our young people are washing their hands. You know, they come into the home, it'll be very important. You know, I can tell you that I leave my clothing out in the garage when I come home and then change and come into the house. There may be even something along those lines with the kids as we anticipate this second surge that could occur as we bring kids back together. I do think there's going to be phases of our education system where some may go on one day, some on another, which will allow that to be spaced out a little bit, which I think will be important. But I think we're going to need to stay tuned to see how that all looks.
If you were in Dr. Amy Acton's position and you were, you know, telling the governor, what would you do about colleges this fall?
That's a tough one. That is really a tough one. I think they're going to have to, I think I have heard, you know, I always wanted a single room. I think they're going to have single rooms, which is great. Certainly the folks will not be congregating. You might be looking at more commuting. I know, guys, for our medical students who want to come in from Michigan, we've had 4 med students this morning cancel rotations from other states because their med schools are saying, we offer the same thing. You're going to stay right here and do your residency here, which is interesting. So I believe college-wise, we may be looking at kids staying local commuting rather than staying overnight. I think it may change things with how we do that. So we are already seeing that here in the last few weeks with our own medical education and rotations to where they're going to stay local, to where there's no housing that's needed. There's, you know, everybody can stay within their own space.
Now, my last question, and if anyone after that, we'll have time for 1 or 2 quick questions if anyone wants to unmute themselves. But my last question for you is, with all of the things, you know, from gloves to masks, the groceries and the clothes and the restrooms and even the gas pumps and everything, if there was one thing that you could tell us to do differently that we could actually do and would actually do, what would that one thing be?
Boy, all of those are so important. I probably would say wash your hands. You know, if you are pumping gas, getting back in the car, if you have a bottle of Purell or something there, just making sure when I get back in, I do my hands and then I do the steering wheel every single time. And so if you're on the go and that's what can be done, you know, I think when they've lifted things, folks, this weekend a bit, we're beginning to see things reopen. Our young people are excited. They want to socialize. We all want to socialize. But I was horrified by what I saw this weekend in the flats because all of those folks are going to go back to family members. I'm not worried about them so much as I am about us. And then our parents. That's what I'm concerned about, to where we could see this surge that we didn't really see initially, that we could easily see down the road. We have to make sure we stay vigilant. And that is my biggest message today, Leslie, is that we must stay vigilant.
What do you think, with your medical background, when is it realistic that we would actually have a vaccine?
Yeah, I think we've heard all sorts of dates. I would say 12 to 18 months. So maybe by March to June of next year would be the soonest that we might see that. I saw something come over my phone this morning that said they had run 20 to 40 folks with the vaccine, and they did demonstrate antibodies. So there's a lot of testing going on, but there's so much, and I know they're going to process this quickly when it happens, but I think accessible to us maybe late winter.
And, you know, I've heard people say, because again, Purell, you know, no matter where I am in the world, if someone asks me where I'm from, I say I'm in Ohio, home of Purell and
Right.
LeBron James. So it hurts me when anyone criticizes my Purell. But I hear people say, well, you can't Purell too much, or can you Purell too much?
Oh, I see a lot of skin changes, and I would guess some of you have seen some skin changes as well. That alcohol can really, for those that are sensitive, it can really dry out the skin, and important to be moisturizing. And so, you know, don't hesitate. Use it. As long as you've got the right alcohol percentage, we usually like 70% or more alcohol, which Purell provides us. We're proud to have them in the area, and it's a critical thing. But we need to be using it. We need to be using it.
My goal is to continue to offer relevant content to continue your professional development and your personal development, because if we're not healthy personally, then we can't do anything about our professional development. We hope you benefit from this program and the virtual and maybe in-person events in our future. Look for a Zoom session in June. If you have a topic you'd like to see, let me know. I'm thinking about a Zoom session on back to school safely. We're going to do a limited version of Horse Talk in July 19th, I believe. Coaching is virtual these days. I thank you all so much. I will be sending you a link. Dr. Plate, thank you. You gave us so much helpful information. I will be sending you all a link to this show in case you didn't get it all written down. There's probably more than you even realized you heard at the time. So Dr. Deb Plate, you can hear her on WAKR. She's a working physician today at Akron General Cleveland Clinic. And I thank you so much, Dr. Plate, and I thank all of you for joining me today. Thank you so much.
Thanks for having me, Leslie. It was fun.